Hi.
How are you?
I'm good. How are you?
Doing okay. Thank you for joining us this morning. I
Oh,
know that, or afternoon, I guess, for you. Um, where we've been focusing a lot on how family and friends can support their loved one facing infertility. And one of the pieces that we've discovered is that the more educated we become on our own without imposing on our loved one who's facing infertility, the more we can offer them support. So
mhm.
we're looking forward to getting a little bit of this fertility 101 from you, so that we are empowered with that knowledge so that we can show up for our loved ones in struggle. But before we even deep dive into the Fertility 101, do you want to take a minute and introduce yourself to the HTQA community?
Sure. Yeah. Well, first of all, thank you for having me today. I am so excited to be able to talk about this topic because, yeah, understanding how to show up for family members who are struggling with infertility, not only family, but friends too, is it's so difficult. There's so much unknown about what infertility is like and the treatments involved and what that process is. So hopefully today together we can, make it a little bit more understandable so that we can support our friends, loved ones, and family. But yeah, a little bit about me. My name is Dr. Cheri Margolis, and I work at Boca Fertility in Boca Raton, Florida. I'm a double board certified reproductive endocrinologist and infertility specialist. And yeah, I am super passionate specifically about infertility and helping couples through it. And there's nothing more rewarding in my job than supporting couples. And of course, getting that positive pregnancy test at the end is just it's such a blessing and I love my job. So I'm really grateful to be in this position and to be talking to you today.
Well, thank you so much for joining us. And as you said, it's so important to be able to support your loved ones through this journey. And so we're going to start with the very basics. If someone has a loved one who has been diagnosed with infertility, what does that mean?
So the definition of infertility varies based off of age. So after age 35, infertility is diagnosed after 6 months of consistent timed intercourse without pregnancy success. And then under the age 35, that timeline is 1 year. So after trying for 1 year, um, without a successful pregnancy. And by the way, that can include miscarriage in that time too. It doesn't have to be just negative pregnancy tests. If you've not achieved the ultimate goal of a healthy pregnancy in that timeline, that is diagnostic for infertility.
And so for under 35, what would that look like?
So under 35, it's trying for 12 months, 1 year of consistent, well-timed intercourse without successful, healthy pregnancy. So either there's only been negative pregnancy tests during that time or only miscarriage.
Right. And so does one need to walk through your door to get the diagnosis, or is the assumption that once you've hit that 6 or 12 month mark, depending on your age, you're officially have an infertility diagnosis, and the next step would be to go to the fertility specialist or to your OB to start this diagnostic process?
Yeah. So you do not need to walk through the doors of a doctor's office to have that diagnosis. That diagnosis is made once that criteria is met. Now, once that criteria is met, I do strongly encourage that you do not wait for evaluation because in humans, time is success when it comes to reproduction. We are more successful at having healthy live births the younger we are. So, unfortunately, time in general is going to be our enemy when it comes to healthy pregnancy. So, I very much encourage that people do seek care right at that mark based off of where they fall. If they're over 35, like I mentioned, 6 months of trying. And if they're under 35, 1 year of trying. While the other thing is, you may not reach the infertility definition until it has met that time criteria, I certainly don't think, and of course I'm biased, there's anything wrong as that timeline approaches to, seek evaluation and just get a checkup and check in regarding, is there something obvious here that I might be missing that my doctor may be able to find in me? And that way you best utilize your time.
100%. And this piece obviously lies in the hands of the couple or individual facing this diagnosis, and for family and friends watching, though we want to step in and help fix, it isn't our place necessarily to be the ones who suggest this. It obviously is a very delicate balance here. So I think that just something to keep in mind is that this piece of it is meant for the individual and the couple who are struggling. Yeah.
Exactly.
Yeah.
Exactly.
Yeah.
You know, it is very much a sensitive topic, and it can
Yeah.
certainly not be so welcomed to
Yeah.
hear from friends or family, like, well, time to go to the doctor. But yeah, this is definitely for the individual.
Yeah.
That's a good timeline to seek evaluation and care.
100%. And so now one reaches that space where they're seeking evaluation and care. What can one expect is going to happen through that process? So I don't want to ask my loved one who's facing infertility, but I want to have a little bit of an understanding of, okay, it's been a year, it's been 6 months. I
Mhm.
hope that
Sure.
they've walked through that door in your office or their local REI's office. What might they be going through in that initial phase of the journey?
So there's a pretty basic workup that we use for anyone facing infertility. Of course, we have to both evaluate both partners, male and female. For men, what else is new? The evaluation is generally going to be a little bit easier than it is
Yeah.
for women. For men, we really just need a semen analysis because that's going to tell us about the count of sperm, how the sperm are swimming, how they look under the microscope. But the rest of the evaluation does fall on the female because not only do we need to know about eggs, like we have to know about sperm, we also have to understand what's going on with the female anatomy because they're the one carrying the pregnancy.
Right.
So for anatomy, what's important is going to be the uterus and the
Mhm.
fallopian tubes. And for the eggs, we're trying to understand what might the egg quality be like. The best indicator of egg quality is going to be female age. And we're trying to understand ovarian reserve.
Mhm.
To put it simply, is, what is the egg supply like when compared to people that are your age matched counterparts?
Mhm.
Do you have more eggs necessarily left than we would expect for your age, an average number, or less than average? And we do things like ultrasound of the ovaries, blood tests like AMH levels to get an understanding of the ovarian reserve. And for anatomy, we do tests like HSG to assess the fallopian tubes if they are open and if they're normal looking and healthy, as well as tests of the uterus like a saline sonogram. This is where we use saline to get a look into the uterus where a embryo should be implanting, and look with a 3D ultrasound and see, is there something in the uterus that's
Mhm.
causing a problem with embryo implantation. So there's some routine tests like I mentioned, men's semen analysis, women HSG, saline sonogram, ultrasound, and blood work to just get a good understanding and overall picture of, is there something as a physician I might be able to find that I can then hopefully fix or optimize as we help a couple get to the end goal, which is a healthy pregnancy and live birth.
And just to give a little context, how long does it usually take to get all these routine tests done? Because when we just list them like this, it sounds like, okay, I come into the doctor's office, I get 1, 2, 3 done, okay, and then in a week I have results. But
Right.
can we put out there just an understanding of the process that this couple or individual are going through in a timeline?
Yeah. So I super wish that it was come in and within a week we would have all the answers, but it's absolutely not like that. I would say an average timeline just to complete the standard evaluation of tests that we're talking about is easily 6 weeks for many reasons. These tests are not done on all the same day. They are also cycle dependent, menstrual cycle dependent. So, depending on when the patient has come to meet me, where they're at in their menstrual cycle, I might not even be able to do these tests for another month. So, for example, the tests like the HSG exam, where we're looking at the fallopian tubes, or the saline sonogram, where we're looking at the uterus, those tests can only be done in a very short window during the menstrual cycle, right after the period ends, but before ovulation has occurred. And the reason for that is that we don't want to disrupt any chance a couple might have at getting pregnant that month by doing the test, for example, after ovulation. So there's a very strict window. So depending on when that couple comes to me, I may not have answers for a few weeks.
Wow. Um, Someone just asked a question here. They wanted to know
Mhm.
what would be the best time in the cycle to go for these tests.
Yep. So the best time is generally for the average person going to be somewhere between cycle day 6 and 10. It's a pretty short window. And again, that's because that's that sweet spot where the period has ended, because menstrual blood can alter the findings of
Mm,
these tests, but also before ovulation has occurred, so that by nature of doing these tests, we haven't altered any chance that the couple might conceive at home that
yeah.
month. So that's why there's this very, very tight window.
Thank you for clarifying this. You put it so succinctly and easy to understand this process of what to expect. So we're now 6 weeks into 2 months in. Your loved one has finished all the diagnostic testing. What would the next step usually look like for them?
So in my practice, I really like to get all of these results first, bring the patient back, have them sit down in my office with me and go over the results one by one.
Mm-hmm.
And in that process, we make a diagnosis, whether it's male factor, because there's abnormality with the semen analysis, whether there might be tubal factor, a problem with the fallopian tubes. I mean, there's many causes for infertility, and sometimes we make a diagnosis of unexplained infertility, where all of the test results come back normal. Now,
Mm-hmm.
unexplained infertility is a super frustrating diagnosis because the normal response to that is, well, there might not be anything wrong. And
Yeah.
in the reality, it is a very real
Mm-hmm.
diagnosis. And our tests and tools that we have are very, very good, but they're
Mm-hmm.
not perfect. So in 2025, the year 2025, there are still advancements to be made to lock down a definitive diagnosis. So while unexplained infertility is somewhat reassuring, it absolutely doesn't negate the fact that it's still infertility and very real and warrants treatment. So we sit down, we go over the findings that we have, we make a diagnosis, and based off the diagnosis, we talk about what the treatment options are that are going to be most successful when treating that specific diagnosis.
Amazing. And so I know that we can't go into each specific diagnosis because we would be here for a while.
Yeah.
And definitely we'll come back and do that another time. But I think that this has given us a clear understanding of what to expect in that initial piece of the journey. It's been 6 or 12 months, depending on your age. You officially have an infertility diagnosis, whether you've walked through the doctor's office or not, you are infertile. Now, the next question is what's causing that infertility? So you walk through
Right.
the doctor's office, and it takes you about 6 weeks to 2 months to do these myriad of tests that need to be done, both female and male related, so that you can get a better answer as to what is the source of the infertility. And now you have hopefully an answer. And some people, that answer is science still doesn't know why. We have an unexplained diagnosis, and so grateful for the continued research that is being done, so that over time, unexplained diagnoses hopefully become fewer and fewer, and we have more explanations. But either way, as you just eloquently articulated, unexplained infertility is still infertility. And so for the individuals who are diagnosed with an unexplained diagnosis, there still are treatment courses. So the next phase is treatment. So whether it's been determined that one can start with an intrauterine insemination or IVF, and I think we'll end kind of with this, or else we could be here for hours going through IUI and IVF, and we will come back and definitely have that conversation. But what is now the time frame? So you've received a diagnosis, and you've determined that they're going to do one of multiple treatment courses. What's now the time frame between diagnosis and the start of a treatment cycle?
Yeah. So, well, it's definitely patient dependent. Sometimes people leave the office and decide if things overall have looked reassuring, they may want to try longer at home. And, that's in many cases acceptable. And, ultimately, it's the patient desires we have to honor. So sometimes people choose to go that route before pursuing treatment. And my couples who are looking to pursue treatment as soon as possible, our limitations vary. One limitation to getting into treatment as quickly as possible is going back to the menstrual cycle. Most fertility treatments are going to start with the beginning of the period. So if your period has just passed and you're mid-cycle and we're having this follow-up and you want to start treatment, we're still looking at, okay, my hands are really tied until your next period comes. So that's one limitation. Other limitations include just the burden of undergoing treatment. I'm going to need to see the patient for multiple office visits for blood work and ultrasound, no matter what treatment they're doing, IUI or IVF. And the patients have to look within, their own timeline, calendar, schedules, and life to say, in my next cycle, am I even going to be able to attend those required visits? And am I traveling, or do I have work obligations or commitments that's going to make starting treatment very difficult on the timeline I desire? And then, of course, another piece is the financial. So I practice in Florida, and Florida is not a mandated state, which is frankly devastating. The goal is to make the United States a mandated country and to have infertility recognized by our medical insurers to be, valid, that they contribute to the treatment, because infertility is a medical diagnosis. But unfortunately, we are not there yet, which means many of my patients in Florida are left without insurance coverage for fertility treatment. And thus, financially, the patients have to look and consider, am I going to be able to afford these treatments? And let me tell you, I don't need to know anyone's financial history to know that these are expensive. Yeah. They are expensive even for people who are wealthy. And so financially, the couple has to look and see, is this even something I can afford right now? Am I going to have to make changes to my lifestyle to be able to start treatment? And also in what way? Because we know things like IUI are less expensive than IVF, but we know that they're still expensive and it may take multiple attempts before any of these treatments might work. So there's financial barriers.
Mm-hmm.
The other thing is even with insurance coverage, which we take all insurances at my practice. So the couples who have fertility benefits, who are lucky enough to have that in Florida, there's still significant timeline limitations because we have to get authorizations. And that can take weeks depending on the insurer. We have to get authorizations not only for the treatments, but for the medications, which in themselves can cost thousands of dollars. So there are so many factors that play into just, okay, I want a baby. I want to start treatment. I'm going to start treatment next week. I wish it worked that way, but it's just, there's many limitations to be able to achieve that.
And so I think that that's like just such an important piece of what you're saying to take into account when you do have a loved one going through this, is that it isn't a just. It is such a long process from diagnostic to treatment to cost to timing. As badly as those of us trying to conceive want to have that baby yesterday, life is still happening around us, and what other commitments we have do take into account our availability. But as you said, the biggest burden is the financial burden.
Yes.
And even with insurance and copays, there's still a tremendous financial burden. And so and 100% with you on the reality that U.S. should be a mandated country for
Yep.
fertility treatment. Here in California, we are blessed to be headed in that direction in the next couple months. But it still is such a process and a lot to keep in mind as you are supporting a loved one through this, that it, in addition to the pain of the journey and the physical pain that one goes through in injecting oneself and in all these diagnostic and treatment procedures, is the big pain of time. Waiting is, I think, one of the biggest hurts that we carry in this journey. It is tremendously painful. I thank you so much for sharing so much with us in so much detail, but making it so clear for all of us to understand. Do you have any last thoughts that you want to leave loved ones of those facing infertility with as they come to support them?
Yeah, I think, a big thing is, trying to delineate, not overstepping your boundaries. And that is so hard to do. But I think one thing, if you know a couple is facing infertility, just telling them that you support them, that you care about them, that you want to give them the space that they might need, but that you're also here for them if at any point they want to, an open ear to listen to and talk things out that they might be experiencing. I know that that is hard, but I also know that a lot of my patients do wish their friends and family had a better understanding of what might they be going through. And just listening to this video, you should be proud of yourself, of what a support you might be to your friends and family. And then the last thing is, I want people to understand that unfortunately, fertility treatment is while it's amazing, it's not perfect. And there are couples who are not going to have success no matter how much effort they put into it. And that, while luckily that is very rare, giving people the space to know that it's not just like, well, if you do IVF tomorrow, why aren't you pregnant? Treatment is not perfect. Treatment takes time. Even if everything were to go perfect with something like IVF, which is generally the most successful tool, we're looking at least at a 3-month timeline from start to positive pregnancy test. So, giving your friends and family that space to know that even the most motivated patient, it might be a very, very long, painful, difficult road. So yeah, that's the main things. I'm really so grateful to have had this opportunity to talk to you today. I don't check my Instagram messages super regularly, but I do check them like a few times a month. So I'll certainly keep my eye open this week. If anyone wants to send me a message, has some questions, concerns about anything we talked
Amazing.
about today, my inbox is open.
Thank you so much for that, and thank you for sharing and so clearly for that piece that you said about just showing up. That anyone who's here watching or who will watch it afterwards, it really is truly just such an incredible piece for your loved ones who are facing infertility to know you care. So thank you, Dr. Margolis,
Yeah, of
for all
course, of
this.
course.
And someone just
Uh,
made
I appreciate her. I don't want to call her
oh.
out, but that's very kind. She's too
Yes.
kind.
Oh, well, rightfully deserved. And if anyone has any issues reaching out, they can always DM us and we can connect them to you.
Perfect. Okay,
Amazing.
great. All right.
Thank
Have a
you.
great day,
You
everyone.
too.